Some communities in West Michigan will soon have access to a maternal and infant cash prescription program. It's called RX Kids, and this summer it will roll out in the 49507 zip code of Kent County, Muskegon, and Muskegon Heights. We're joined now by the founder, Dr. Mona Hanna. Thank you so much for joining us today.
It's great to be with you, Elena.
All right, so first question, what is the goal behind RX Kids and how do you achieve that?
Yeah, the goal is to improve health for mamas and babies. So it is a maternal infant health program. I'm a pediatrician. It's run by MSU's medical school. So the number one goal is at a population level to improve maternal and infant health. And that's what we're doing. RX Kids is soon to be in 60 communities across Michigan. And all of our evidence shows measurable improvements in family stability, maternal and infant health.
So why expand this program to these new communities this year?
There's a lot of demand. There is not a day that goes by when we don't hear from communities across our state, when is RX Kids coming here? Families are facing the impossible costs of having a baby. The maternal infant period is actually when families struggle the most economically, but medically, that's the most important period. What happens in the prenatal infancy window really shapes your whole life course.
Awesome. So this program you started this in 2024 in Flint. What kind of success have you seen since RX Kids began?
Yeah, that's a great question. So we did start a little over 2 years ago in Flint, which happens to be one of the poorest cities in Michigan. And right away, we saw a really high take-up. So lots of folks enrolled, a near 100% enrollment rate, which is really phenomenal. And then we started seeing other impacts, improved family stability, less evictions. We actually had a 90% drop in evictions. Even the threat of eviction in a community, not even for an individual, but if a mama lives in a community where there's more evictions, she actually has a higher risk of preterm labor. So we're seeing at a community level more stable outcomes, more nutrition security. So families have more of the food that they want to eat. Mamas are more likely to go to prenatal care. We're seeing improvements in prenatal care access. Mamas are going earlier, more often. We're seeing less smoking in the third trimester because folks are going to prenatal care. They have less stress. Improvements in maternal anxiety and depression. And most importantly, we are seeing those population level improvements in birth outcomes. Less premature babies, less low birth weight babies, less babies needing to go to the NICU. We also just had research come out on a prevention of child welfare involvement, a 30% reduction in involvement in the CPS system. So lots of tremendous outcomes, which is really built on the global evidence base. This is done around the world where families, where governments and communities support families for this short window.
Awesome. Well, we're so excited to have this here in West Michigan in this expanded role. Thank you, Dr. Mona Hanna with Kids RX for joining us today.
Thanks for having me.
So registration